in the folder, it's got handouts and information, and then Ginger has one that is fairly similar, but this has some things for an activity that we're going to do. But I do want to start with talking about decision making, because right now you are kind of the crux of making all kinds of decisions, not only for your own health, but also for the health of your baby and your family. And so there's a decision-making sheet in here with some tools to help you make some of the decisions that you're going to be making. So as you are presented with options, and we're going to be talking about some of these options today, you can use this brain tool so that you can assess the benefits and what is the benefit of moving ahead with this. What are the pros? And then also the cons. What are the risks associated with these different choices that I'm going to be facing? And then any alternatives can be listed in the boxes below as well. Is there anything that I can try other than the mainstream standard option, right? And then what is your intuition telling you? And then next or nothing. If I decide to go ahead with this, then what happens next? Or if I decide to do nothing, what is that going to look like? So there's a space for your question and then what you decide to do and what the outcome was. So you've got this little tool here, and then it's blank on the back, so you guys can take notes on the back side of this, or you can also use it if there's another thing that pops up during the course of our discussion that you want to go ahead and start exploring the same thing. But there is another decision-making tool on the next page that is Empower. So, minute. How much time do we have to make a decision? Do we have time to think this out? Do we have time to make a decision? And then plans. What were they? What were you planning on doing? Are they needing to change? Are those options still available? And then W, wait. How long can you wait before making a decision? How long will your care provider let you wait? And what is that going to look like? And then evaluate. So that's going to be your pros and cons. And then R is reaching a decision. So Empower, that's just another little acronym that you can look at as we're navigating some of these decisions. Some of these decisions might include whether or not you want to test for gestational diabetes during your pregnancy, or vitamin K. What is that going to look like? Erythromycin. All of these decisions that you'll be making for your newborn, or GBS testing. Do I want to have any STI screening during my pregnancy? Is it really needed? There are a lot of decisions that you're making during this process. So those are just a couple of tools in there that you guys can use as we navigate some of these discussions today. So the next page is all about labor. So there are three kind of divisions for the stages of labor. And I like the acronym EAT to remind you to be eating throughout your process. Because during early labor, that's kind of when you're noticing things are starting to pick up. There's kind of an establishing pattern, but nothing is really getting super intense. You're still able to talk through things, you're moving, and you're able to go about your day. So remember to be eating, because by the time you reach transition, you're not going to want to eat. So contractions are usually pretty irregular during early labor. They're lasting 15 to 45 seconds, sometimes up to a minute. You're holding conversations. This is usually the longest part of your labor. This is going to take up the most time. And in a first-time parent, this process can look like it starts before you go to bed one evening. And then it kind of is going through the night, and you might be super excited. You're like, oh my goodness, I'm going into labor. We're going to meet our baby. And then it keeps going all night long. And it kind of peters off in the morning, but it's still just kind of there. And then it may pick up that next night. So early labor, make sure that you're getting lots of rest. You're eating a lot of nutritious foods. And just distract yourselves. Try and go about your day like you normally would. Get lots of sleep. Don't get so excited that you're going to meet your baby that you're exhausted and really struggling to cope before you get to meet your baby. Get lots and lots of rest. So your body, during this early labor, your cervix is going to be shortening, and it may start expanding. It may open a little bit, but usually it's softening for the most part during this phase. And your baby is making their way down into your pelvis. So I'm sure that all of you have experienced your baby making their way down a little bit further into your pelvis, right? They're kind of up here floating during the first part of pregnancy. They're so little that they're just kind of flipping around, doing their thing, lots of kicks and wiggles. And now that things are kind of progressing and getting a little more established, baby's making their way down and causing a little bit more pressure, yeah? So baby is going to continue to do that. So that's one of the first movements that your baby is going to make, is that they're going to make their way down into the pelvis and engage. And then they're going to make contact with your tissues, which is going to cause their head to flex. And that's when you're going to be experiencing your active labor. As they're making contact with those tissues and really causing some stretching, it's going to start causing changes to your cervix, because your baby is going to be right there on top of your cervix. And they're going to start with that expanding and not opening. So you may experience like losing your mucus plug during your early labor. You may have some blood-tinged mucus. Sometimes your water will break, but it's not like the movies. You typically are not going to have your water break and then contractions start. Usually it's the opposite. You're going to have contractions for a good long while before your water breaks. And then you're moving into active labor. And this is where it's getting more intense. You're going to notice that your contractions are getting longer. Your contractions are going to be more 45 seconds to 75 seconds. And they're going to be growing in intensity. You're going to be experiencing some new sensations. You're going to be feeling more pressure. You're going to feel them even lower. And this is when you want to make sure that we know that things are starting to happen. And you're going to notice that they're going to go from being more 10 to 45 minutes apart to 5 to 10 minutes apart, or 2 to 5 minutes apart. They're going to be getting closer together and longer. And the way that you actually time your contraction is from the onset, and then you'll end it when it stops. But then the time between is actually calculated from the beginning of your contraction to the beginning of the next one. Okay, that sounds a little bit weird. Most of your contraction timers are going to be accounting for that, but it's beginning of one to the beginning of the next is how far apart they are. Okay, and then your body during active labor is going to be opening and finishing thinning of the cervix. So your cervix starts out about here to here. It's about that big. And so your process is going to be opening, thinning that out, and then opening the cervix so that there's room for baby to come. This is when you're going to invite your birth team to join you, is when you're in active labor. And you may have your water break at this point in time. If your water breaks, that's something that you want to make sure that your birth team is aware of. So, and then transition. This is the final, most intense and shortest part of your labor, and I promise you're not dying. You will make it through, but it is very intense. This is going to be the most expansive, the most difficult, the most rewarding kind of part of the whole experience. So you get to the end of this, and then you get to start pushing. So your transition, usually your contractions are about 1 to 3 minutes apart, and they're lasting anywhere from 1 minute to 90 seconds. So it feels like they're right on top of each other because you're not getting a whole lot of time between. You're going to have anywhere from 30 seconds to a minute between the onset of each contraction. You may experience nausea, shaking, vomiting, being super sweaty or feeling super cold, and a lot of rectal pressure and feeling the urge to push. So it is going to feel like you need to poop. Okay, and it just is part of the experience. Your baby's head is coming down and your rectum, oh, I was gonna bring my model and I didn't do it. The rectum and your uterus are kind of lined up like this, and your baby's head, so your rectum is coming down back here, right? And your baby's head is going to be right there pressing against it. And so anything that is in front of baby's head before their head is right on top of that is going to come out while you're pushing. And so pooping during labor is totally normal, nothing to be self-conscious about, nothing to be worried about, because it's just part of the process. And your care providers are used to seeing it. So just know it's part of the process and embrace it now, because it really is okay. So your baby is coming down and they are going to be turning inside, because you can see in this pelvis, is it shaped exactly the same way all the way down? Your baby is going to fit kind of like a lock and key in the pelvis. And so it's going to have to rotate in order to unlock and to be born. So baby has been aligning and coming down and flexing and causing your cervix to open. And now they're going to turn so that they can be born. And then they're going to extend their head with your pushing efforts, and you're going to push. And then your baby is actually going to rotate once their head is born. So head is born, and they actually have to rotate, just like I said, lock and key, so that their shoulders diameter fits in that outlet of the pelvis. And then shoulder will be born, and then you'll get to meet your sweet baby, right? And then after you push your baby out, you have your beautiful placenta. And your placenta has been attached to you this whole time, and now there isn't a baby that's taking up all of the space in your uterus. And your uterus is going to continue to contract down, and it's going to release the placenta. And your placenta will be delivered after there are no bones, and so it's just this warm, soft, squishy thing that is going to come out after baby. And generally, there is no reason for us to disconnect your baby from the placenta until after it's delivered. So you'll have this beautiful unit of baby and placenta. So we are actually going to build a baby. So inside your folder, you've got your baby, and you have a placenta, and then you have 2 grocery bags that we will use as well. So we've got scissors, and you guys can cut out. And I have one more pair of scissors, so one couple can tag team. Anybody?
Do we cut along the bloodline?
Yep, so you can just cut out along the black line. It doesn't have to be exactly on there, just so that your baby's not a rectangle anymore. And the placenta's not a rectangle anymore. Alright, and I will let you pick out your umbilical cord. You'll need 2 of one color and 1 of the other. So you've been growing this beautiful baby through your entire pregnancy. And it is actually your placenta that has been helping you do that. Through your umbilical cord. How many of you guys have been spending any of your time imagining what your baby's gonna look like? Yeah? What are you guys seeing? Do they have dark hair? It looks like we've got lots of dark hair in the room. Lots of hair when they're born, or are they bald?
I've had heartburn, so I bet they're no hair.
Are they usually bald?
Lots of babies are bald, and lots of them have hair, so it really just depends. Okay, so when you're ready, you're gonna take your 3. The umbilical cord has 2 arteries and 1 vein. And they're just kind of twisted together. So we can just gently braid these together. And these veins and arteries are protected by something called Wharton's jelly. And it helps ensure that the cord doesn't get too compressed and that the baby is receiving everything that they need because the veins and artery are not being disrupted. And sometimes you'll see that the cords are super coiled, sometimes they're very straight, sometimes they're really thick and big and round, and sometimes they're nice and thin, kind of like a shoelace. But they all, most always, have these 3 vessels. Sometimes there are 2, sometimes there are 4. It's pretty uncommon, and it is something that is screened for during the anatomy scan. If you chose to have an ultrasound, that's something that they're looking for during that anatomy scan. Making sure that the blood flow is looking good to baby. You got the little scissors, man.
I'm just taking as well.
And then you can just kind of twist off the end so that it doesn't come undone. Okay. So I didn't cut out a placenta, so I have this one from yesterday that is already put together. So most often we're going to see insertion kind of like this placenta here, where it's going to be pretty close to the middle, but that's not always the case. Sometimes it's going to be on the outskirts of the placenta, and sometimes, rather than it all being twisted together, it actually inserts like this, and is what we call a velamentous insertion. And so it isn't protected by the Wharton's jelly all the way down. It's protected up to about here, and then it's just within the amniotic sac. And so there isn't as much protection there. And all of that is within normal for a placenta. So you guys can choose where you want to put your cord. I'm going to let you guys
Alright, thanks. I'm gonna get one.
Yep, I'll tell you what to do with the bags in just a second. So your placenta is not a one-dimensional object like this. It's actually really 3-dimensional. And this is the fetal side. This is a beautiful, shiny fetal side. Your baby is living next to this side of your placenta. The other side, the blank side, is the side that actually attaches to you. So imagine that you glued on a whole bunch of cotton balls here, and there's kind of these spaces in between, right? There are these kind of cavernous spaces, and that is how it inserts to you. It inserts on your uterus, and your blood kind of fills these spaces. And your baby's blood is interacting with yours through this really thin layer. So the paper is kind of that layer that's protecting. So your blood is not exchanging during pregnancy, but you're transporting all of those nutrients to your baby through that layer, and then it's taken and it's then given to baby through the umbilical cord. So we're going to take the umbilical cord, and you now get to attach it to your baby. So you'll just stick it on where you would expect a belly button to be. And then we have these 2 sacs. So something you may not have known is that with your placenta there are 2 sacs, not just one. There's the amnion, which is by your baby, so brown for by baby. And then there's the chorion, which is gently attached to the uterus. And so you'll put the brown one inside of the white one. And now you get to put your baby inside the bag. Don't do this with a real baby. And the placenta is actually going to stay on the outside. So this is the most time-consuming part. We're going to be taping your bags to the placenta. So you'll just start in one spot, you'll just tape it on there, and then you'll kind of pleat it around and continue taping all the way around. So you have a final product, something like this. I know, sorry guys, you have the hard tape for this.
No, it's okay.
I need a lot of it.
A lot of little pieces.
And still some tape to do like that. That's fine.
Are you good?
Huh? No, the baby is supposed to be inside. Yep. I had to do a video of this for my class, and so mine has been born and then shoved back in, so it doesn't happen in real life. Beautiful.
Any more? No? Done?
No, I did the wrong side.
I think I did too, so I was copying hers.
You did the wrong side. What do you mean?
I just put the placenta face up.
Mm. Done.
You'll get the concept. I think this ball might be just a little bit too small. Okay, so you now have your baby in the sack, right? So this meaty part with those imaginary cotton balls attaches to you somewhere. And in general, it's not going to attach to your cervix, but that is possible. If it attaches to your cervix, then that is contraindication for your beautiful home birth that you've been planning. If you've had an ultrasound, then they will have already told you that not a good idea. And we will be watching for signs of any bleeding or anything that might occur, but we're not worried about it. Usually, your placenta is going to attach to the top of your uterus, or sometimes it'll attach to the front. And if it's attached to the front, then you may notice that you're not feeling as much movement from your baby. And that's totally normal because your placenta is acting like a pillow against the front of your uterus, and your baby is just kind of taking against this pillow, and you're just not going to feel it as much because, I mean, we scream in a pillow to muffler, right? So kind of the same concept. So now we have this beautiful uterus, and we've got our cervix, and we've got our baby's head, right? So this ball is just a little bit too small, so it's not quite going to give us the same effect here. But how many of you have been having Braxton Hicks with your pregnancy? Okay, so usually Braxton Hicks, there are two different layers of muscle fibers in the uterus. There are muscle fibers that go this way, and there are muscle fibers that go this way. And so Braxton Hicks typically are involving those fibers that are going across your belly, and so squeezing, and it's not making a whole lot of change. It might be doing a little bit, it's thinning that cervix, but it's not until you get into that more active labor. The muscle fibers are connected to your cervix, and they're pulling up and pushing your baby down, and pushing baby down. And baby comes out!
Just that easy. Like that.
Yep, just like that. They fly out. Just like, I promise. So you have this, and when your waters rupture, you're going to get a hole in your bag. So go ahead and make a hole in your bag. And you can use your scissors. Yep, both of them. And in general, your baby is going to come out through this hole head first. Sometimes we will see variations of that, and we will have a baby that decides to come out bum first. But your baby is going to come out, and then you still have them attached to your placenta. And the placenta is still attached to you until your body has contracted and released it from the uterine wall. And then, oftentimes, it'll kind of turn inside out. And it will be delivered with this beautiful, shiny fetal side. But after baby is born, again, we still have this beautiful unit. And then we will cut and clamp the cord. So we will place a clamp here close to baby, and then we'll place an instrument here, and then we'll cut between that. And this is going to stay with baby until about day 7 or 10. And it will fall off on its own, and you'll just keep it nice and dry, keep it out of baby's diaper, and it will fall off. And then they'll have this cute little belly button. So, your beautiful baby, to remind you.
How long do you normally wait to cut the placenta after birth?
We usually wait until the placenta is delivered.
Okay.
If there is no reason for us to cut it immediately, then we just leave it alone.
What would be a reason for you to cut it immediately?
If it is so tight that we can't do anything else to help baby get out. But there are other ways that we can use to help a baby get out. Because the cord being around baby's neck is actually really common. About 1 in 3 babies have a cord around their neck. And so it's not anything to be super worried about. I know the people tell their story and they're like, and my baby had their cord around their neck and they were gonna die, right? Have you heard those stories? 1 in 3 babies have a cord around their neck. Usually we're able to loop it over their head, or we'll bring it down over their shoulders, and they can be born through their cord. And if that isn't super feasible, then something else that we can do is baby is coming out. So this is pelvis. We're going to gently help support baby's head towards mom and keep baby as close to mom as possible so that they can be born close. And then we'll just twist baby and hand baby up to mom. Does that make sense?
Yeah.
Did that help clarify? Yes. Awesome. So, the umbilical cord can be short or it can be long. It's usually about 24 inches long. Sometimes they're shorter than that, and so sometimes when baby is born, we need to keep them nice and low because their cord is just not short enough to bring them up to the chest. So even still, it's not necessarily a reason to cut it. We can wait until the placenta's out and bring baby further up to mom. But All right. So, early labor. We've got a list here of things that you can do during early labor to help you just kind of stay distracted. So, work on an early labor project. That might be something that you have decided beforehand that you want to get done before baby comes. It can be a nesting thing or just something fun. You wanted to paint or you want to go and have a mani-pedi done. Go do it. Go get it done. That can be your labor project and go get it done. Stay hydrated. Drink lots of water. Have a light meal. Eat easily digestible foods so that you're not feeling gastrointestinal upset as you're trying to have your baby. That's going to make things feel even more yucky because nobody wants to deal with gas pains on top of everything else that's happening, right? So that's going to be whole grains, non-citrus fruits, vegetables, and you may want to elect for lighter meats like your chicken instead of your red meats. Those are a little bit more easily digestible. Take a walk. Go be outside in nature. Don't be too active. Like I'm not saying go hike a 14er because that would be a little crazy. So be active, but alternate periods of activity and rest. Make sure that you're getting enough rest, especially if you're noticing that this is picking up in the middle of the night. Don't get up and start painting your nails and doing your labor project. Maybe grab a snack and try to go back to sleep. And use the bathroom frequently. Keeping your bladder empty is going to help you remain comfortable. If things happen at night or early in the morning, get a snack and try to go back to sleep. You can take a warm bath and see if that helps soothe some of the aching. And again, go back to sleep. Get as much sleep as you can. If you are experiencing back labor or extreme pain, then you may want to do things to help correct baby's position. Those horizontal fibers are often trying to help baby adjust their position so that they're getting into the proper position for birth. So if you're experiencing pain, it's usually related to the position of the baby. So get up and dance. Shake that baby, get their head to line up. Get down on your hands and knees and scrub the floor. Bring that baby's back towards your belly, because if they're posterior, you're going to be experiencing a lot more of that aching and pain in your back. So bring their back to your belly. If you have young children, which none of you guys do, but if you have nieces and nephews or brothers and sisters that are close by that like to play on the floor, get down and crawl with them. Play on the floor with them. And then you can also have your partner do counter pressure for you, and that's something that we'll go over in just a little bit. Or you can also do downward dog. That helps gravity work by pulling baby out of the pelvis, and then when you come back up, it helps them kind of reset because gravity is now working and they can adjust before they go back into the pelvis. Okay. Positions for labor and birth. How many positions have you guys seen people use for labor and birth? That can be movies, or if you've attended somebody's birth. What have you seen?
All the time.
Awesome. I love that you guys have seen all kinds, because the most commonly portrayed is the lithotomy position, laying on your back with your feet up in the stirrups, right? So what are some positions that feel good to you day to day? What feels good? Squatting.
I would say like sideline.
Sideline. Okay. With your pregnant body, what feels the most comfortable on a day-to-day basis? How do you like to be?
Recumbent.
Okay, awesome. That's okay.
Yes.
Okay, so we're actually going to, I'm going to show you this first. So this is your pelvis, okay? This is actually what you sit on. So you have a curve in your low back, and so your pelvis is usually sitting kind of like this. And then when you sit down, the pelvis actually rotates clear down so that you're sitting on this, right? So different positions are going to change the angle and the shape of how your baby is coming out. So if you're on your back like this, see your tailbone here? What's happening as you're pushing baby? they're having to work uphill, right? So what happens if we turn this the opposite way and we go into like hands and knees position? Your baby has a little bit more space, right? Because they're not having to push against that. And their back is against your belly. So we're going to play with some of these positions. So I want you guys to stand up. And we're going to get a little bit awkward, right? We're going to touch your bum, and you're going to find those bones in your bottom. So I want you to feel for those bones in your bottom. Okay? And now I want you to just bend and see how it changes. Feel how it changes. And then lift one leg and feel how it changes. You can lift the other leg. Drop down in the squat. Can you feel how those are changing? Okay. So, really, in the home birth setting, there is not really a limit on what kind of position you're in to give birth. So you can be in whatever feels good. And as your labor is progressing, if there are any suspicions of anything, we're going to give you some advice on maybe try squatting for a minute. We think that maybe changing the shape and the diameter of your pelvis is going to be beneficial at this point. So go ahead and just take a squat. Sometimes it feels really nice to just kind of open up your pelvis. You can rock back and forth. During active labor, you typically are going to find kind of a rhythm and a ritual, and sometimes that's going to be rocking, sometimes it'll be moaning, sometimes it'll be, patting your partner's hand or whatever it is. You'll usually develop a ritual, and that means that you're engaged in the process and you're coping pretty well. Go ahead and come down, and you can go into hands and knees. So I had mentioned offering counter pressure earlier. And as you're getting into active labor, that's usually when you're going to want these kinds of things the most. So partners, I'm going to have you come and be with your lovely lady. So counter pressure is another way that we can kind of manipulate the shape of the pelvis. Mine is a little bit more rigid, so you're not going to see it as well. But you've got these hip bones here, right? And as you press on them, the body is actually pretty flexible, especially because we have relaxin going on in our bodies when we're pregnant and we're getting ready to have a baby. So pushing on this is going to flex this open. And sometimes it feels really, really good because it's just creating more space for baby. And as baby is moving, where it feels the best is going to change. Same thing with the sacrum. We can press on the sacrum to help open it up. It's kind of like opening the hatch of a hatchback car. Your baby is trying to open up that hatch so that they can come out. And so we can press on that to help open the hatch just a little bit more and give them some support in that way. So go ahead and find your partner's sacrum. It's going to be kind of a flat triangular space at the base of their spine. So it's down almost between their bum cheeks. So nice and low. And go ahead and just give that a little bit of pressure. Usually it feels really good even at this stage in pregnancy. Good, it looks like everybody found it. Okay, so now see if you can find the hip bones. Hi. So the hip bones are up here, and you're going to go below that just a little bit. And you're going to try and have your hands in the same place on both sides. Can you right her hands on? Nice and even. Hello. Hello. I'll just jump right in.
Okay, so what we're
And you
doing,
can press
we're
really,
talking about,
and you can even come down a little bit lower.
We go
Massage
to
your hips.
the sacral.
There
you go. Is up
Give
on
that
the
disc.
crest. So feel that ridge there and use the palm of your hand. Are you doing, yeah. So you want to use the palm of your hands right there on that crest to squeeze in. Think of a clothespin, right? Where you squeeze the top mouth together and bottom opens up.
Too much.
Right,
Just like that.
Uh-huh.
How's that feel, Abby?
Right here.
That's good. I think I need to like.
And then squeeze your hands together.
Higher?
Yeah.
How that better?
Changes the shape of your pelvis? Yeah. Okay.
Okay. So those are two things that you can do to
Are you going
be
in?
involved
Alright.
and be supporting your beautiful ladies as they're going through this process. You can be doing this with her, especially until we arrive. If they're experiencing a lot of back pain, usually these things are helping alleviate that. And if they're wanting to sit, then they can sit. There's not really a great chair, but if you want to go ahead and just take a seat against the wall and you can just put your knees. So that sacral that we showed you, if they're in a chair, you can actually push directly in towards their hips on their knees, and it's going to be offering that same pressure. And then there is a handout in your folders, so that you guys can kind of explore some of these things together. So are there any positions that you guys think sound, you guys can go back to your seats. You can sit down, I'm sorry. Are there any positions that sound particularly comfortable to you or that you kind of envisioned your birth happening in? Hands and knees.
Down the hall.
But if you're doing like
Would
water,
you not or you?
Hands and knees can totally happen. That's a great question. The only thing with water birth is we need to make sure that the water level is high enough to cover your hips so the baby is born into the water and there's not this half and half. And so really that's the only consideration, and usually it's not a problem unless you're super tall. And sometimes it's an issue, and then we just have you keep your bum in the water. And so, yeah, hands and knees is a great position in the water. You can be semi-recumbent if you want to in the water. There are really unlimited options regardless of where you are. Even when you're in the water, you can be in almost any position you want to be in. So.
Can we take a minute to introduce our new ones? Did you do introductions the first time?
No, I didn't. So now is a perfect time to do
Can we
introductions.
do that? Tell us about yourself, where you live, what baby this is. Never mind, it's first for everybody. I'm just gonna spoil that. And when you're due, the thing you're most excited about, and your biggest fear. Valentine will start.
Okay, I'm Valentine. I'm due May 12th. I live in Udall. My first kid. What am I excited about? I'm just excited to do a home birth. I don't know anyone that's done it, so I'll feel like, yeah, I did that if I do it successfully. I'm not really nervous for anything yet, so let's go.
We'll create a few things to give you some
yeah, so I'm Abby. This is Irvin. This is our first birth. We're from here in Wichita. We're excited. I don't know. I'm
What do you
excited
do?
about doing our home birth. When I do May 7th. And yeah, I'm excited about doing a home birth and just like completing it and kind of seeing what my body's able to do.
No fears?
I mean, I have like just I feel like the general fears of how the home birth is gonna go and making sure everything goes well, but no overwhelming fears, no.
Do you want to fill up your back?
Yes, actually, that would be great.
There's like 3 under these couches eat you, so we have more pillows if you need them. So yeah, there's plenty. And there's another one on the floor beside you if you need to.
I'm Sean, this is Mandy. We're from Wichita, due June 7th. Originally from Colorado, but we live in Wichita now.
It's here.
We did not commute from Colorado. Let's see, excited. I don't know if I could really put one thing on it. Excited to meet our baby girl, for sure. And pretty scared about, I guess like everything, what could go wrong. I think as for me personally, I don't have any family members or anything. I don't know anybody other than her siblings that have done a home birth. So it's a completely new experience for me and my family.
Yeah, and we're not really near any family other than my
Also
sister. So we're kind of doing this on our own.
I'm Nolan's chairs. We are due September 1st. We're late because we actually had our first, what is it called, ultrasound? Yeah, we had it this morning. We live in Kansas City. And I'm just a little bit nervous just because I have 15 nieces and nephews and none of them have done a home birth. So I'm like, alright, this is something new for all of us, like you were saying. But I'm excited just because our families are close and big, and so the baby's gonna be loved, and we don't know what we're having. So
You don't?
don't know.
Yay.
We got a piece of paper, but she
She
won't
said her
look
mom
at it.
can, her mom can have it.
I was
so.
gonna ask, is it staying a surprise or is it staying a
That's
surprise
the plan.
until
As
a
of
gender
now.
reveal?
That's the plan, unless he just cannot. So,
No gender reveal.
yeah.
Okay.
Yeah.
And
see.
So fun.
Valentine's having a surprise.
Yep.
And Abby and Irvin are having a
Boy.
and you already know you're having a
Girl.
Yeah.
So. Okay, and I'm Elise. I think that all of you except for you two. I'm Ginger's student. I am a senior student. Finally, it's been a very long journey, so I am excited to have met all of you and to be here with you today. This is my first time teaching a childbirth education class. I've done childbirth education with my doula clients, but it's always just been one-on-one, and usually they've taken a class. So it's just kind of a refresher or going a little bit more into detail, because some childbirth education classes are really comprehensive and some of them just kind of skim the surface and they're like, okay, tell me more about this. So if I know Ginger told these guys earlier, if you have any questions come up, there are a few blank pages on the back of pages in here. Go ahead and write things down and feel free to ask questions as we go along as well, because I want to make sure that you guys are getting the information that you want and not just the stuff that I have in here or we think you need to know, because there's plenty of information. There's a lot of information about how this works, why it works, and we want to make sure that you guys have the answers that you need to feel comfortable and confident in birthing your baby, because God made your bodies perfect for this, and so we're excited for each of you to have a beautiful birth experience. So.
I also have one question. Were you born at home, Abby?
Yeah.
So Abby and Cheris were both born at home. Were you born at home?
I was not.
So tradition continues.
Okay, so we just went over a little bit about positions, and now we have this form for partners. These are things that you can do, things that you can say to help support your lovely lady throughout the process. So encouraging her to get enough rest, encouraging her to eat, helping her remember to take a drink, because it's really easy to get distracted, especially the further you get into the process. It's really easy to just be focused on coping and not remember, oh, I really should be taking a drink, I need to keep myself hydrated, or take a deep breath. Sometimes it's really hard to remember those things. Suggesting that she take a shower to help relax, or taking a nap. Reassurance and praise. Sometimes having a focal object during labor is really effective. So giving her a picture or an object or something that she can focus on can be an effective way to help her navigate during her labor as well. Light touch. There is a theory called the pain gate theory. And so what this is there is fear, tension, and pain. So if you're afraid, what do you usually do if you're scared? Are you super relaxed? Super loosey-goosey? No, you're gonna tense up, right? You jump. And so now you're tense. And now you're fighting against what your body is doing, right? And so that's going to create more pain, which then can create more fear, because you're like, oh my goodness, I'm not supposed to be feeling this much pain. And you're like, oh my goodness, I don't want to be feeling this. And so there's more tension and more pain. But then there's this gate theory. distract the nerves, as well as eliminate the fear, then we can kind of eliminate some of these sensations. So light touch is one of the ways that you can do that. So that might be like scalp stimulation, rubbing her hair, playing with her hair, giving her a light massage, or even a more firm massage, rubbing her back during contractions can kind of help distract from these sensations because the nerves are distracted elsewhere. So we want to eliminate the fear so that we're not having those sensations of tension in the cervix. And then we can also distract the nerves by providing some kind of touch or counter pressure. So those are things that can be done to help support your partner through this. So if her back is hurting, helping her change positions, providing counter pressure, having her lean against the pain with her own fists, because you offering counter pressure can be really effective, but sometimes you're just not going to be pressing in the right spot. It's like, no, that's not it, that's not it. So if you can put your own hands where you're feeling it and provide that pressure, sometimes that can really help. So leaning against the bed or the wall with your own fists where it feels good, you can provide counter pressure to yourself as well. If arms and legs start to shake, reassurance that that's normal. Holding her steady so that she can feel more in control, rubbing hands and feet. Sometimes it's because she's cold because there are these hormonal shifts. She's having these cyclical hormonal shifts to help labor progress. And it can cause these like hot flashes and cold flashes, so putting a blanket over her to help her stay warm can also be effective at helping with the shaking. And then if contractions stop or slow down, encouraging her to rest, helping her get things picked up, talking about labor and encouraging rest and relaxation. Oxytocin is the biggest hormone that is affecting labor progress. So another thing that you can do is you can hold hands, you can kiss, you can snuggle. You can do all of those things. You can be intimate to help get the oxytocin flowing, and that can help stimulate contractions to come back on. Going on a walk, sometimes that movement is helping adjust baby so that you can get that pressure evenly on the cervix again, and that can help stimulate things as well. And then in the back, there is a handout. It is how can your partner best support you during labor. I want you to hold on to that one, and then you're going to do this one at home. Okay, and it's just kind of a letter, and it's going to help you review ways that you can support your lovely lady during her labor. So list of ways that you help your partner relax when she's had a stressful day. Because some of these things are still going to be applicable when she's going through labor. If she likes having massage, she likes being touched, usually they still like being touched during labor. If they hate being touched, then you're not going to be using that to help them cope during labor. You're going to find something else. You're going to be pulling out her favorite essential oil or whatever it is that helps her relax instead of touch. What do you do for your partner when she's in pain? Does she like massage or hot or cold or just a hug? How do you make her laugh? What does your partner like to reminisce about? Are there happy times in your relationship? Are there pictures or objects that remind you of that? Does your partner like to talk about the baby and what they're going to be like? Imagining that together. What can you say when she's feeling discouraged? And does she respond better when you remind her of her goal? Does she respond better to you being assertive or gentle? Things to consider. And then, do you understand her wishes for what her birth is going to look like? So, I think that directly behind this one, there is like a little scoring sheet. Oops. So there's this scoring sheet so that you guys can kind of go over this together and determine what your values are for your birth. Is it more important to you to be safe and comfortable than it is to have a healthy baby at home, right? So things for you to consider, and if you fill this out, you can stick it on your fridge, and then Ginger and I can take a look at it. That way we know what's important to you during this process, and we can help support you in those things that are most important. highlighted in the back of the folder are things that can be looked at later. But they are there for you to help kind of explore what you want your birth to look like. Okay, so now a little bit heavier. Preterm labor and what to look for. Okay, each of you are getting pretty close to having your baby, so the risk is decreasing, right? Preterm labor is any time between when they're viable to 37 weeks. If they're born before 37 weeks, that is preterm. And 37 weeks is still early. 40 weeks is full term. It's not until after 42 weeks that it's actually considered post-term. You hear people saying, oh, your baby's post-dates, post-dates, post-dates. They're not actually post-dates until after 42 weeks. So anywhere from 37 to 42 weeks is still within totally normal, but sometimes babies do come early. So what you're looking for, risk factors are being pregnant with multiples. Your ethnicity and race actually plays a factor in whether or not you have an early baby. Maternal age. So being extremely young and being an older parent puts you at increased risk. So if you're under the age of 23, there's a little bit of an increased risk of having your baby earlier. And if you're over the age of 40, you're at increased risk of having your baby early. Tobacco use or the use of any other recreational drugs or alcohol, some kinds of infections, low weight gain, low iron levels during pregnancy, which is why we're testing your blood to make sure that that's staying good. High physical or mental stress. So if you are working a lot and you're on your feet a lot, you're lifting things that are heavy, you're going to be putting a lot of stress and strain on your body and on your baby. And then short intervals between pregnancies. The closer together your babies are, the more likely you are to have babies that are earlier. So what are you watching for? What do you think you would be watching for? I know you guys have answers in front of you, but what do you think you would be watching for? What are some of the signs that you would watch for? No changes.
Temperature. If she has fever.
Yeah, fever.
Is this what are we watching for like early labor? Like, are we going into labor? Is that what you mean?
Yeah, so preterm labor, you're going into labor and it's too early.
Contractions?
Oh.
If you're having contractions and they're not going away, you're trying hydration, you're trying position changes, you're trying a hot shower, and they're not going away. That's a warning sign. What else are we watching for? Your water breaking. If your water breaks before your 37 weeks, it's really hard to make sure that you've got enough fluid in your body to keep a baby in there in the amniotic fluid for the rest of pregnancy to have a delivery at 37 weeks, right? You would have to be drinking like 10 gallons of water a day to make sure that you have enough fluid to keep your baby in your body. And in general, it's just not going to happen. And we would rather you be in the hospital and have someone that can take care of your baby than to try and have a baby at home, right? What else are we watching for?
Maybe like the baby's head lowering into your.
That can be, yeah. So we're looking for change in your vaginal discharge. If we're seeing that there is mucus plug and you're only 32 weeks, we're going to be wondering if something's going on, right? Having that lower pelvic pressure, like you were talking about, baby's head is coming and engaging, and you're starting to have those kind of low contractions, cramping, we're going to be concerned. Backache, menstrual cramping, if you're having bleeding, all of those are concerning and warning signs that you may be having your baby early. These are all the signs that we are also looking for if you're having your baby at 37 weeks. So you're looking for those same things and just an awareness of your body. If you're experiencing sensations that you think that you're going to have your baby and it's early, then you need to let your care provider know, and you may need to go into the hospital to have things done to help stop labor or to go ahead and have a baby safe. Yes.
And you said 37 wouldn't be early.
Yeah, once you're 37 weeks, and sometimes there's a little bit of leeway depending on how confident you are on your dates, or if you're 36 and 6, that baby might be okay to be born at home, right? But a baby that's 35 weeks, we're gonna be on, no thanks. We wanna make sure that that baby's gonna be able to get the care that they need. But 37 weeks is when we have the clear to have your baby at home. Yeah. So if you think that you are having preterm labor signs, then you're going to go pee, and you're going to go pee frequently, because sometimes having a full bladder is going to cause some uterine irritability. Drink plenty of water and lie down. If you're not drinking enough water, it tends to make your uterus more irritable. So if it could just be irritability. If we can get you hydrated and get you fed, have you lie down and rest, sometimes things will peter off and they'll go away. Lie down on your side to rest. Record any contractions that you have, the length, how far apart they are, and any changes in intensity. So again, kind of the same thing as if you're going into labor. You're gonna wait until things seem like there's a pretty solid pattern, and then you're gonna maybe track and see how far apart they are, and you're gonna let us know that information. And then call the midwife. You're gonna call and let us know what's going on, okay? Management, if you are in preterm labor, then we will go to the hospital for assistance from an OB. We're gonna make sure that your baby and you are getting the help that you need to have a healthy, safe birth and a healthy, safe baby. Sometimes medications can be given to stop this so that you don't have your baby early. If you have a history of preterm labor, which none of you do right now because this is your first baby, but progesterone has been shown with some weak data that it can prevent preterm labor. And then getting certain nutrients in your diet, those omegas, and plenty of vitamin D and iron, and just making sure that you're nourishing your body is going to reduce the risk. So, nutrition is a big deal. And then there's information on what preterm delivery means for your baby. Most of you are not going to have a preterm baby, and I'm not worried about it, and I don't want you to worry about it, but that information is there so that you can look at it if you want more information about it. We just want you to know that sometimes it happens, and we want you to know what to look for so that we can get it taken care of if it does happen, okay? All right, so doulas. How many of you have hired a doula? Sort of. How many of you have heard of a doula? Okay, everyone's heard of a doula. So a doula and a midwife, do you know the difference? A lot of people don't. A lot of people really don't know the difference, and that's okay. So there's this little chart here that kind of talks about some of the differences between midwives and doulas. Does anyone want to volunteer to read what midwives do? It's kind of small, I know.
Where's this chart at?
The page looks like this.
Don't know that we got that page.
Okay, may have gotten skipped. I'm sorry, guys.
I can read. Midwife, work with client from early pregnancy through postpartum, medical professionals who care or low-risk clients. Make sure the parent and child are safe, maybe in and out throughout the laboring process.
Perfect. Will somebody read what doulas do?
Work with clients at the end of pregnancy, during birth, and postpartum. Non-medical professionals support high and low-risk births, physical, emotional, and informational support, and enable client's voice to be heard. Provide active and continuous care when client desires through birth.
Perfect. So what do both midwives and doulas offer?
Support.
Work together to make clients safe and supported.
Yeah, so we're working together to make sure that clients are safe and supported and happy and as comfortable as possible during labor. Midwives have a clinical responsibility to their clients, and a doula is mostly there for your emotional support. So if you feel like you need someone that is going to be totally attentive to you and your emotional needs the whole time, then you may want to consider hiring a doula, because as the midwives, we're going to be focusing on your emotional needs, until it's time for baby to come, and then we're really going to need to transition into a more medical clinical role, because that is what we are there to do, is to make sure that everything is going well clinically. Doulas are a really great resource, especially if you have a good one. A really great doula is worth their weight in gold. An inexperienced doula can actually be a hindrance, and they can just take up space in the room. So it's really up to you to decide whether or not that is someone that you want to be in your space for your birth, but it is an option. It is an extra cost, so that's also a consideration, but doulas can be a really great tool to help you through your laboring process. So doulas and midwives are a different role. Okay. So now your baby is born. So there is, okay, so I did not go over this. There is a little handout in the back, pain management during labor. For the 5 senses, there are recommendations and just tips and tricks that you can use using the 5 senses to help you be more comfortable during your labor and birth. So, you guys can just hold on to that. Okay, so baby has been born. And how many of you are planning to breastfeed your baby? Everyone's planning to breastfeed? Awesome. So we've got this establishing breastfeeding handout here. Okay. So ways to prepare for a good breastfeeding experience is to have an empowered pregnancy and birth. That does not mean that births that end in cesarean section are not going to be satisfying, right? A C-section can be empowering as long as you have the information that you need to make the choices, to feel confident that that is the birth that your baby and your body needed or wanted. So having an empowering birth. Having skin to skin immediately after delivery is going to promote that experience. That's going to get your oxytocin flowing. It's going to help stabilize baby. You're going to be getting all of these different cues. Your baby is going to be bobbing their head, which is stimulating the glands in your breast. And that's going to help you develop milk. It's also, baby's feet are going to be pressing down on your uterus, which is helping your uterus contract. And it's just creating this whole cascade of hormones that's preparing your body and your baby for a good breastfeeding experience. Skin to skin is regulating your infant's temperature, respiration, and facilitates earlier breastfeeding than taking baby away from their parents in that early postpartum. Postponing routine procedures until after the first feeding is complete. Generally, in this practice, we're not doing any of those procedures until after you have had bonding time with baby, you've fed your baby, and we're getting ready to go, and then we're going to do all of those checks. So we don't know how much baby weighs until just about before we're walking out the door. So there's no need to know that right away. It's not the most important thing. Making sure that your family is bonding and that your baby is getting fed is more important to us than making sure that we know how long your baby is and how much your baby weighs. Breastfeeding within the first hour after birth when possible. This is your golden hour, is what they call it. And the instincts in your baby to get a good latch are imprinted more distinctly during that first hour. So when that's possible, when your baby is interested, when your baby is healthy and able to breastfeed during that first hour, that's when we like to see it. We don't want to be taking away your baby and delaying that. That's going to help set up a good breastfeeding experience. Delaying the use of a pacifier until breastfeeding is well established can also be helpful. It's going to help prevent nipple confusion because the suck for bringing out milk on the breast is different than the kind of suck that is necessary to hold a pacifier in the mouth. There are some pacifiers now that are being designed to kind of simulate that and to be more similar, but it's still just a little bit different. And so waiting until breastfeeding is well established can be beneficial to helping with that. And then avoiding the use of supplemental feeding. Supplemental feeding can set up this really vicious cycle. You give babies some formula, and you're not getting the stimulation you need to make the milk that your baby needs. Your baby is now full and they're sleeping longer, which is also impacting how much milk your body's making. And your baby's not nursing as often. And so it's just this whole cycle that leads to not making enough, which is generally the concern, right? How many of you have kind of been led to believe that you have to pump your milk in order to have enough? It's a really, really common belief that you have to pump or you're not going to be making enough milk for your baby. And that's not necessarily true. There are things that you can do to help make sure that you have enough milk. There's the Haka. I know that Ginger has one that we can show you in a little bit that you can attach that will catch your lead down. Some people, when they are lactating, are going to be expressing milk on the opposite side from where they're feeding their baby. Some people do, some people don't, some people lose a lot, some people don't. But that's something that you can use to catch milk so that you know that you have extra just in case. But your baby, as long as they are being fed on demand, and you're watching your baby instead of the clock all the time, watching for those hunger cues, and you're feeding your baby, your body is responding to their cues and is producing as much milk as your baby needs, and so you're not going to be experiencing as much engorgement. If you're pumping all the time, then you'll need to continue pumping to make sure that you stay comfortable, because your body is producing for the demand of your baby and the demand of the pump. How many of you are returning to work after your baby is born? Nobody? Okay. So if you were returning to work, then pumping would be a greater consideration because you would need those stores of milk to help feed your baby. But you lovely ladies are going to be with your babies the majority of the time. So watching your baby and not the clock. Most babies have the desire to feed every 1 to 3 hours. Some babies are going to cluster feed and they're going to be eating every 30 minutes for a couple of hours, and then they're going to give you like a 3 to 4 hour stretch, and then they're going to want to nurse every 30 minutes again for a couple of hours, and then they're going to give you that longer stretch again. And that can be totally normal. Feeding your baby at the earliest hunger cues can also be very helpful so that you're not trying to bring a screaming baby to the breast. Some of those early signs are wiggling and moving their legs, rooting, and fingers are coming to their mouth. So when your baby starts to kind of wake up, especially in those first couple of weeks, your baby is waking up and typically it's because they're getting ready to eat. So that's a great time to bring baby to the breast and try nursing and see if they will take it. Some of the mid signs are going to be that they're a little bit more fussy. They're going to start making some squeaky noises. Maybe they're crying intermittently, but they're not screaming. And then late, they're screaming and they're turning red because they're really hungry and they're really mad. They want to be fed. And I know that I can get pretty angry, and so I don't blame a baby for being that way either. And there is no need to offer both sides at every feeding. However, your fore milk, you are going to have more watery milk that comes first to hydrate the baby, and then you have thicker, creamier milk that is following. So as your baby continues to eat, they're getting the fore milk, which is hydrating, and then they're getting that hind milk. So it's kind of like drinking a glass of water and then you eat a bar of chocolate. Sometimes you need to wash it down, so you're going to go back for like a glass of milk, right? And so sometimes babies like to nurse on the opposite side because they've had enough of that cream that they need to wash it down. And so offering the other side can be just fine, but it's often not necessary because they may end up getting more of that hydrating milk than the fatty milk, right? And we want our babies to grow and to be chunky, happy, healthy babies. So offering both sides is fine, but it's often not necessary. Wait until the first side is completely drained, especially if you can feel how full your breast is. If you wait until it is soft and supple and then switch. You want to wait until that fullness is gone so that you know that your baby is getting that creamy milk. And then it can kind of be considered not only that like drink of water, but almost like dessert. You give your baby a meal and then you give them dessert. You're going to know if your baby is getting enough by their diapers. There's not a whole lot of other signs other than their weight gain and their diapers that's going to tell you that they're getting enough. When you feed a baby a bottle, you see that they drink the whole bottle, right? Well, when they're drinking directly from you, it's hard to know. But there's this little image here your baby's stomach is about the size of a blueberry on day 1. So they're not needing a whole lot, right? And that first day, you are producing colostrum, and there's not a whole lot of it. Have you guys heard it called liquid gold? It's kind of this golden color, it's kind of a honey color, and it's there, and there's not very much of it, and it's very thick. It takes a lot of effort for your baby to get it out. But their stomach is very small, and so they're going to need to eat more frequently because their tummy is so small. And then on day 3, their stomach is about the size of a grape. So their stomach is getting bigger, they're growing, they're learning how to eat. And day 3 is typically about when your milk is going to come in. You're going to start having this transitionary milk where it's going from colostrum to your more mature milk. And so it's still going to be kind of this yellowy milk, but it's when you're going to be experiencing that fullness in the breast. You may have really, really hard breasts, and your hormones are going to be changing really rapidly on day 3. Your placenta isn't in there anymore to be producing hormones, and so your body is now adapting to no longer having those hormones, and they usually have kind of exited your system on day 3. So day 3 tends to be a really emotional day. Your hormones are changing, your milk is coming in, you're really engorged, and it's finally hitting you that you have a newborn and you're exhausted. So day 3. Just know that day 3 might be emotional and you might cry, and it could be for no reason, or it could just be that you're feeling really sad, and you might miss being pregnant because now you have a newborn that you're caring for on the outside, and it's really overwhelming. That's okay. It's a normal transition to parenthood. So men, you're probably not going to be experiencing these things because your hormones aren't changing like hers are, and so just knowing that it might be a really big day and embracing that and being able to help her and support her through that. And then 1 week, your baby's stomach is about the size of a large olive. And then by 1 month, their stomach is about the size of an egg. So they're getting more and more and more as your body is responding to their demand. And then diapers. Day 1, we're expecting that we're going to see at least 1 diaper, 1 poop and 1 pee. Day 2, we're expecting that we're probably going to see 2 diapers. Day 3, we're going to see 3. And then by the time we get to 14 days, we're expecting that we're going to be seeing 6 or 8 at least. And that doesn't mean that there's going to be 6 wet diapers and 6 poopy diapers, but we are expecting that we're going to be seeing wet and poopy diapers. And if you're seeing an increase in number during those first 2 weeks, you know that your baby is getting enough. If your baby, is not pooping, then it tells us that there might be something going on and maybe they need a chiropractic adjustment, or there might be something else going on that needs to be explored. If their poops are green, it gives us some information that they might be getting a little bit too much air, and usually a chiropractic adjustment is going to help with that, or evaluating baby's latch is going to be beneficial for that. Usually you're going to have these kind of mustardy yellow, we call it seedy, where it kind of looks like little granules in their poop. And that is what we would expect to see from a breastfed baby. And then nursing positions. There is not just one way to hold your baby when you're nursing. Usually people will find a favorite and they'll kind of stick with that. But changing positions, especially in those first few weeks when your breasts might be a little bit more tender and you're learning how to get a good latch, figuring out what positions work best for you and your baby is going to be really beneficial. So there's the cradle, where you're holding baby this way, cradling baby, right? There's the football hold, holding baby this way. Side lying is when you're laying on your side and you're bringing your baby to you. And usually it's a little bit more challenging with a newborn just because they don't have as much head control yet. But we did successfully see side lying happen this morning with a brand new baby. So it is possible. And sometimes some of these more like side lying positions or a reclined position are going to be effective for women that have larger breasts just because there isn't as much gravity. And if you have a really heavy letdown, you might feel like you'll have kind of a tingling. And if it sounds like your baby is just gulping and struggling to keep up, or they're coming off the breast and then milk is just spraying. Sometimes that means that you need to be in a more reclined position. It'll help prevent as much milk from getting into them at once, or you can even pump a little bit to express until you have a letdown and then attach baby so that they don't struggle as much, so they're not gulping as much air. Breastfeeding should not, and I repeat, should not be painful. It will be uncomfortable. It will be a new sensation, but there should not be pain. If you are experiencing pain, then that tells us that there is something wrong, and it's usually baby's latch. I was told that pain was totally normal for the first several months, and that it might be toe curling, blood curdling scream pain for the first few months of breastfeeding. It is absolutely not the case, and I do not want you to embrace that because it is not normal and it is not okay, and you do not need to go through that. If that is happening, then we need to work on getting a good latch, or we need to get you help with a lactation consultant so that you can figure out what's going on and get the help that you need so that you can have a good breastfeeding experience, because that is absolutely not necessary. If you are having cracked nipples or bleeding, that tells us that there's something going on that needs to be evaluated and needs to be changed. So that is breastfeeding. Are you guys overwhelmed yet? Okay, let's stand up and stretch and take a little break. You guys are amazing. The bathroom is just right there to the left if you need to go potty. Starting to get sweaty.
Teacher's ultrasound is good. Yeah. Bruce Box, so that's good. Yeah, we run a lot. Yeah. Around doing those. Yeah. Yep.
Did they print pictures for you, or did you get
We have a
a flash
yeah,
drive?
flash drive.
Okay.
So, yeah, it's exciting. Yeah.
Do you guys feel like you were able to see any resemblances? I feel like some people like to.
Not
I feel like it's
yeah,
really hard
like-
with ultrasound, but
Yeah.
some people are like, oh, it looks just like so and so.
Yeah, not yet.
That big nose. The Sarah nose.
Like a long nose or like fat nose.
That's what,
Like
that's
they're all
what it looked like on
nose
ours
and
too.
that. Yeah.
But,
I know they always look like they have kind of like a squishy face.
yeah.
Was it a 3D ultrasound or was it 2D? I don't know. If they do diagnostic 3D.
Oh,
We do
Not bad.
Well, I just don't know if they do
Excited?
diagnostics 3D.
I am.
How far are you guys in?
June 7th.
June 7th, oh, I see.
We're about
Because I
31.
knew in
Yeah, about a
ultrasound
month
that they
after.
did
Yeah.
3D, but they
So
didn't do
you're
diagnostics.
coming right
Yeah,
up on it.
it's coming in like
Diagnostics.
less than a month.
Sooner than.
Sooner
You ready?
Yeah, I feel ready. I'm excited to like
Massive
learn
ring,
about everything. You know,
Right?
everybody.
Do something.
Yeah, we're in the middle of renovating too.
Oh, wow.
We're just moving right now.
Yeah.
Oh,
We've
yeah.
been doing it for like the past month. So now we can kind of relax. We have a place.
Yeah, we just moved here in January. Colorado, yeah, we pretty much spent our whole lives in Colorado.
Well, if
Oh,
you have any questions or
And
anything.
just moved out here second week of January. So we're settled in now, but
What did you guys move? Just for family?
work. I got a new job out here in Wichita, yeah.
Prenatal
Yeah.
days, he usually just stays behind his chair, he knows
36.
36, okay. Has it been like, is 30?
Yeah, no, I don't think.
Well,
so.
I feel like this stage of pregnancy
Yeah.
is supposed to be the longest. At least that's what I've heard.
Yeah,
Like the
pretty
last.
nice feeling.
Okay.
What are you at?
31.
39. Yeah. I mean, I feel like
Yeah.
the past like couple
Isn't
weeks
it
have been
supposed to
like,
be
okay,
7
now I
years?
feel pregnant. Like,
Yeah,
this is-
yeah, for sure.
I think
I'm
they're.
feeling that right now, so that makes me nervous.
I mean, there's also like good weeks and bad weeks. So like next week.
Um,
I don't know.
It's good to know.
I mean, we're still feeling things. Yeah, I think I can keep it going for another.
Yeah, they never was awesome.
Yeah,
No, because we didn't have
Definitely.
membership.
Yeah,
It's
doing a lot,
expensive.
cause
It's like
I guess
$300
we've been renovating
to
for a while.
have like a golf
Or
membership.
they Rebel House, so
And you know,
I think
you're
it'll be
offering
good for
5 times a year in
starters.
golf.
It's exciting.
Yeah.
And you're able to stay
One of the
home
golf
or
courses
maybe
up in
then.
Hutch.
What'd
The
you
membership
do?
to the golf course is
I'm
included in
a-
HOA.
Analyst at a
Yeah,
financial
live near a
firm.
golf course.
Oh, really?
Just a loan company in town, yeah.
Oh, that's
Mostly
sweet.
doing
$300
fraud
month
prevention.
Resident seems
Mm.
pretty steep.
Yeah, what about
Like
you?
what, cybersecurity?
Mm,
Sort
Just
of?
the way it is.
no, more just like on
Yeah.
kind of like data modeling stuff.
Oh,
Trying to
yeah.
see if we can, pick it out
Any like,
up front.
I wouldn't want my HOA to be elevated.
I,
you know, purpose.
did my bachelor in computer science and went on in for
But
grad school.
yeah, the guys who
Getting
golf
MD in
with,
business
they're-
and all that. So, yeah,
Nice.
that's, it's kind of similar to
they're
what you're
Chiefs
doing.
golfers,
Yeah.
A lot of
and they'll only
modeling.
do golf.
We
on
have
all
a-
the courses.
We have a big development team because we're a web-based company only.
Mhm.
So I don't really do a lot of that stuff, but more just like the statistics side of it.
That's what I want to go to.
Yeah.
I don't really like coding like that.
I know.
I'm better with numbers. Like,
Yeah.
dealing with models.
Right now I'm doing.
Yeah, data visualization. I want to get into real estate though.
Real estate?
Yeah.
I really think real estate's cool too.
Yeah.
Commercial or
Probably residential. It's because it's in the interest of time because I want to get property.
yeah.
Her dad actually owned like pretty decent amount of property.
I'm also
That's
like nervous though,
And,
because like
So say
bought
we
it,
don't
this
really know
house
anyone here.
but I
for us,
just
so
think
to
we're
take
gonna
over the mortgage and renovated.
So
So I went
it's
through
gonna be
the whole
interesting. We
process
need to
for scraping the wall and stuff. I feel like now I'm pretty like comfortable. So big goal is to try to find another property like that, which you can renovate and like have a great time.
Never sell, just keep building
Yeah,
more
yeah. Maybe even Airbnb, like,
Yeah.
here it's like, it's very different. And you have control of your own career.
That's awesome.
Yeah, definitely. I don't want to step on it.
Okay, so we've thrown about an hour and a half's worth of information at you. How are you guys feeling? Are your brains gonna explode? Are they melting?
Not yet.
Pretty good. Actually, it makes me excited about learning. I feel like I learned a lot.
Awesome. Okay, any questions that have come up that you guys would like to discuss? Yeah.
So, just one question. Someone told me recently that they, for the first like month or so, they were having their baby like sleep on their chest, like that skin to skin contact. Is that something that's like good or?
Skin to skin contact is amazing for helping regulate a baby. A baby isn't able to regulate their own temperature for about the first 4 to 6 months. So being skin to skin with their parent helps them learn how to regulate temperature, and you are a stable, healthy temperature for the baby. And they're also learning how to breathe because they've been practicing breathing in utero, but now they're having to actually breathe air, right? And so being on you is helping them regulate their breathing, and it also helps regulate their heart rate. And there's a lot of kind of speculation on how and why that works, and these electrical impulses that are being shared between parents and the baby, but it's helping regulate their heart rate as well. So it's all very helpful, and again, it's stimulating the oxytocin. So it's a really great way for dads to bond with their babies, because mom is breastfeeding baby, mom has been growing baby, and so there's a lot of this time and a lot of these hormones and a lot of different things that are enabling the person that's growing the baby to bond with the baby, right? And so that skin to skin contact can be really beneficial for the dads, for siblings, for other people that are involved very closely with the care of this baby, so that they can bond with the baby and they can help in that way. So yeah, skin to skin is great, especially in those first 24 to 48 hours. That's kind of that critical period where as much as possible during that first 24 hours, so that they can really learn to regulate during the first 24 hours.
Okay, can we back that up for just a minute?
Yes.
And let's go back to your original question, and can you ask that again, just like you asked it?
So are want to know if it's safe for like the baby to like sleep basically
Oh,
the
sleep.
whole night, like on your chest.
Okay, so safe sleep practices. It is okay for your baby to sleep with you. There are things that you want to make sure that you're doing to ensure that your baby stays safe. So if you're going to be upright and baby is on your chest, then you'll want to make sure that you're taking precautions, you're sleeping in the middle of the bed so that if baby does roll, they're rolling onto the bed, right? So you're wanting to make sure that you're participating in safe sleep practices. You're not going to want blankets to be up over baby. You don't want pillows to be around where baby is going to be. No cords. And you want to make sure that you're remaining unintoxicated. So you're not participating in any drinking. So no alcohol, no recreational drugs while you're sleeping with your baby.
And would those safe sleep practices be, like, who established those those particular safe sleep
I'm trying to remember
practices?
the name of the organization. I don't remember.
So would they be mainstream, or this would be, if somebody came to your house and said you practice safe sleep, would that be considered safe sleep?
Yes, so there are a list of safe sleep practices. You can find them on the Leche League. They are well-studied, established safe sleep practices.
Can we talk about some downsides of that,
Downsides to co-sleeping.
to specifically baby sleeping on your chest all night?
So specifically baby sleeping on your chest at night, it can reduce the amount of rest that you guys are getting. It can cause baby's chin to fall so that they are not getting as good of respirations. And so sleeping with baby to the side of you could be more effective and safer in helping both allow you to get rest, baby to get rest, and to make sure that they are getting enough oxygen.
So it's not better for the baby.
It is not better for the baby. So, you know, the thing about a baby is it's a detachment process. So you want to actively attach and actively detach, right? Nobody wants a 2-year-old that has to sleep on their chest forever, right? Okay, so you always have to think, you know, with the end in mind. Okay, where do we want this to go? Of course, you want your baby to feel loved and secure and all of his needs to be met. You always want that, right? But you are unable to effectively meet your baby's needs if you're exhausted. So first and foremost, you have to care for yourself so you can care for your baby, okay? So when a parent gets overly tired, I'm telling you, you might not even recognize that the baby's gone. So, you know, I'm just being honest. You will encounter a level of tiredness as a parent that you can't even imagine is possible. At this point in your life, I mean, you've probably been tired. You've pulled some all-nighters. You can't imagine the level of tired that you will experience as a new parent. Okay, am I right?
Yes.
Yes, right. I mean, it is unreal. So, you know, if you've ever woke up and went, oh my gosh, where am I? Right? Now imagine doing this with a baby on your chest. Like, oh my gosh, where's the baby? Right? Right? We experienced that this morning, okay? Dad falls asleep holding the new baby. We get ready to do the newborn exam and we're like, hey, wake up, you know, we need to do the newborn exam. Can you hand me the baby? Oh, okay, sure. Hands the baby over, lays down, goes back to sleep. 30 minutes later, where's the baby? I have the baby, where's the baby? Okay? Alright, so first and foremost, take care of you so you can take care of your baby. It is very important for babies to have the ability to expand their chest, to develop lungs, if they are always cramped. So some people are like, my baby will only sleep in a car seat, not safe sleep, okay? If you're in a car and you're traveling somewhere, right, to the grocery store, to go see grandma or whatever, it's okay. But night after night after night, and babies like this, lungs will not develop appropriately. So it can restrict breathing, not safe sleep. Baby needs to be on a flat surface. So even in your bed, I mean, I really recommend a co-sleeper or something that is there. When baby is near you, it's hearing your breathing, it's feeling your breathing, you're able to pat the baby, but know yourself well enough to know, am I aware of where my baby's at all the time? Moms tend to have a better instinct with where baby's at. God just gives you that maternal instinct. Like the heaviest sleeper mom can be like, where's my baby? Dads, they don't get that.
And your sleep
Just don't.
changes. After you have a baby, your sleep changes. You aren't going to be sleeping quite as deep. You're going to be more aware of all of the sounds and all of the movements because you're going to be responding to your baby's cues.
Moms.
Yes, moms.
Dads.
Yeah,
do
dads do
not.
not. My husband still is a rock. Like, I had literally kicked him off of the bed because I was so exhausted. I was like, please go get the baby for me. And I literally kicked him out of the bed and he rolled onto the floor and was still sleeping. So I went and got the baby.
I feel like I'm already a light sleeper. But so, what would be the best? Would it be having like a little baby crib next to your bed, or is it on your bed would be the best?
That's going to totally depend on your circumstances and what you find to be most effective for you. Having a bed in your room is going to allow your baby to be close and for you to quickly respond but still have that space and you're not having to worry about where baby is, if you're going to roll over baby, because those are some of the risks of having baby sleep in your bed, right? Is losing that awareness of where your baby is. And so if that is something that you want, then definitely be looking into those safe sleep practices and make sure that you're arranging. You want to have a firm mattress. You want to make sure that there aren't blankets. And so, you know, some of those things, like if you like sleeping with your blanket up around your face, like you're probably not going to want to sleep with your baby in your bed or else your sleep is going to suffer because you don't get to have that blanket up by your face. So having baby nearby in a co-sleeper that is attached to your bed or in a crib that's only a couple feet away may be a better solution. Does that answer your question?
Yeah. And do we have that in the book, or is there a website we can look for?
Yeah, you can go to La Leche League. So, and I thought that I had a handout with it, and it turns out that it wasn't actually a handout, but I do have those safe sleep practices that I can print out for you, and I can bring to your next prenatal visit if that's helpful.
Yeah, definitely.
Okay,
Thank you.
awesome. I can do that for you. Wonderful questions.
What was that site called?
La Leche League International. And I think, is it LLI.org?
LLI.org.
It's LLLI.org, I think. Yeah, La Leche League International. And then you can just put in their search bar, safe sleep. Any other questions that have come up?
What about baby sleeping on like the stomach in the back? I always knew like where he was smarter to have them sleep on their stomach, but then there were studies coming out that they can't breathe, so it's smarter for them to sleep on the back. But is there like an age where like
There is a lot of changing information, and as we've seen, the recommendations have changed over time. And so the recommendation right now is still for baby to sleep on their back. Keeping baby on their side can also be an effective way for them to sleep because, especially in those first few days where they have a lot of mucus and stuff, it allows for it to drain out and they're not they're not choking on it, and so they may sleep a little bit better. Some babies, regardless of how hard you try, are not going to sleep if you put them on their back. They will only sleep if they're on their belly. And so trying to get your baby to sleep on their back is great. Something to recognize is that a lot of infant mattresses are also formulated with formaldehyde. And so if your baby is sleeping on their stomach, then they're going to be breathing in those fumes, which is one of the reasons that they have made the recommendation for baby to sleep on their back. So if you have an organic cotton, bamboo mattress, whatever, then those risks are reduced, right? They're not going to be breathing in those fumes. And so one of the reasons that recommendation has been made is because they noticed there was an increase of SIDS, and there are some suppressed studies. I probably shouldn't say this on a recording for school, but there are some studies that are out there that have actually been hidden that it was correlated to breathing in these toxic fumes, and the babies were dying from SIDS because of some of the fumes that were being inhaled. So considerations to be made.
I had a question going off of that. What is like your personal recommendations for like what you've seen for like swaddling while sleeping? Like, is it more beneficial for the baby to be swaddled while sleeping, or kind of like free range?
It's a really great question. I have found, and the research that I have read suggests that swaddling your baby for the first few days and even up to the first few weeks is really beneficial, and then slowly unswaddling baby. So starting with swaddling their arms, because they're coming from a really tight environment, right? They're used to being all snuggled up nice and tight. And they are likely to startle themselves awake. And then as they develop, as their nervous system is developing, they're less likely to startle themselves awake. And they're wanting a little bit more of that freedom. And so moving the swaddle down to just swaddling their legs so that they're a little bit more snug, or getting one of the sleepers that is, like, what are they called? Like the cocoon sleepers, I think they're called, where their legs are together and they're kind of limited, but their arms are free. It helps with their development to allow them to move, and it actually helps them not startle themselves awake when they're 6 months old because they haven't been swaddled that whole time. And so swaddling your baby and then slowly allowing them to have more freedom as they become more developed is really beneficial that way. Does that answer your question? Ginger, do you have any?
I have a lot, but I'll go over it. I will let you finish in 2 hours, I think.
That was a really great question. Okay. Any other questions?
I just want to make sure also when you said, I think you said when timing contraction, you start like at beginning and end for timing contraction, but time between, you don't do end to beginning, you do beginning to beginning.
So the beginning to beginning, so if you're having contractions that are 2 minutes apart, that's beginning to beginning.
Okay.
And then the actual contraction may be 60 seconds, it may be 75 seconds, it may be 90 seconds.
Okay.
But then timing between contractions is
Use
2
the
minutes.
words that we're going to use for that so they can associate that.
I'm not sure what you mean.
So frequency,
Duration.
and intensity.
Okay. So frequency is how often they're occurring. So every 2 minutes, you're experiencing a contraction, right?
So frequency is timed how?
From beginning of contraction to the beginning of the next.
Okay.
That is your frequency. Duration is how long the contraction is lasting. So that's going to be your 15 seconds, your 45 seconds, your 90 seconds, however long you're experiencing that sensation in your belly.
So beginning of contraction to end of contraction.
Yeah.
And then your intensity is how much you're feeling that sensation. Is that sensation continuing to get bigger? Okay, thank you so much for helping clarify that. Okay. Any other questions? Ready for some more information? Okay. So now we're going to talk about postpartum. So we've got a preparing for the postpartum little trifold in there. So you have finally met this beautiful little person that you have been so excitedly waiting to meet. And now there's going to be a lot of shifts. You're going to be kind of figuring out what your role is as a parent, as a person, as a partner. You're going to be investigating what your baby's role is. Who are they? What are they going to become? And then it talks about how baby blues are normal for day 3. We've talked about that. And it is normal for you to kind of be questioning what things are like for you in the first 6 weeks. Transitioning to parenthood, especially for the first time, is a challenge. And so that cannot be understated. There are going to be feelings of loneliness. There are things that people just don't really talk about. I feel like it's becoming more common to talk about it with social media, and people are finally saying, like, no, parenthood is hard, right? Having a baby is hard. Where for a long time, people just didn't talk about it. And so it's okay if you're not loving every second of parenthood. Sometimes you're not going to experience this intense love for your baby the minute you see them. And that's okay. Your love for your baby is going to grow. And it doesn't matter if you had intense love or not, your love is still going to continue to grow for your baby. Your body is going to make a lot of shifts and changes in the postpartum. Your pregnancy hormones are going to decrease. Your uterus is going to decrease in size. So after a baby comes out, you are not going to snap back to your pre-pregnancy shape and size. Your uterus is going to remain larger than it was before you had a baby. And it is going to continue to contract down until it's your pre-pregnancy size. After pains may be uncomfortable, you're going to continue experiencing cramping. You're going to experience that as you're breastfeeding your baby, because those oxytocin hormones that you were experiencing that were helping you have your baby are going to be helping get your uterus down. So there are things that you can do. You can use herbs, you can use homeopathics or medications to help manage after pains. We will be giving you plenty of information about that in the postpartum period. I know that there are some recommendations on your birth supplies handout. So there are things like arnica, and there are herbs, and you can have ibuprofen or Tylenol on hand that you can use postpartum to help manage those after pains. The perineum, that's the skin that is between the vaginal opening and your bottom. Your perineum may be swollen, it may be sore, it may have torn. The hope is to prevent tearing, and there are things that can be done. How many of you have heard of perineal stretching? Okay, we'll talk about that in a little bit. And your vaginal lips may be tender. A lot has happened. There was a lot of pressure. You may have pushed for a long time. You may have pushed really fast. And so a lot happened that doesn't usually happen in your vagina and your perineum, right? So it's going to be a little bit tender. Using a peri bottle when you go to the bathroom can help with that. You can use padsicles. You can use like a warm pack to help with swelling and tenderness. And witch hazel pads are all things that you can use to help manage the discomfort. After your placenta has come out, you now have a wound inside your uterus. This was attached to you, and now you're going to have kind of a scab, right? But because it's inside your body, it's really hard to get a nice, dry, thick scab, right? So you're going to continue bleeding, probably for a couple of weeks, and your bleeding is going to act as a guide. As your bleeding decreases, you know that you're getting enough rest, that you're taking care of your body. If you try to make the bed, or you do a load of laundry and you find that your bleeding has picked up, your body is telling you that you've done more than it is ready for you to do. So be listening to your body. Be watching for those signs so that you know what your body is ready for. Your bleeding may continue for several weeks, so have plenty of pads or adult diapers on hand. Adult diapers are really convenient because you don't have to worry about lining up your pads so that you're not bleeding in your underwear or leaking onto your clothes or whatever, so they can be really convenient. They do have chemicals in them that sometimes make your belly kind of itchy. So just be aware of your body and know if you're sensitive to those kinds of things that may guide your decisions. Movement is your friend as you are healing, but take it easy. Walking is one of the most effective exercises that you can do to help restore your body. It's effective at helping restore your pelvic floor, in building those muscles and helping develop that strength again. It helps tone the core, it tones your arms, it tones your legs, and it's gentle movement. I'm not telling you to go out and walk 5 miles like 2 days after you have a baby, but going outside for a walk around the block at a week postpartum so that you can get some sunshine and spend some time with your baby and get some movement is a really, really great thing to do. Your breasts are going to enlarge and change. You've probably noticed as your pregnancy has gone on that your breasts have been changing, right? It doesn't stop at the end of your pregnancy. You are going to have that milk come in, and the milk is going to cause changes to your breasts, and so your breasts will continue to grow and change. And there is going to be tenderness, especially in those first couple of weeks as you are regulating your milk, and those changes are happening. So if you find that you are very engorged or you're really uncomfortable, your breasts are painful, you can pump or hand express milk until you're comfortable. Unless you are going to be pumping to store milk, there's no need to pump or express more milk than that. Sometimes jumping in a hot shower will naturally express that milk. Otherwise, you can press directly toward the chest wall and then squeeze forward, rolling your fingers forward, and that will hand express milk. I can grab a breast model and help show you guys that a little bit later if you guys are interested in learning more about that process. Nutritional depletion from pregnancy is a real thing. You've been taking a prenatal vitamin. A prenatal vitamin is designed to give your body as much as your baby needs. It's not designed to give you nutritional stores. And if your baby, as they are developing, needs any extra anywhere, Your baby is pulling from you, from your nutritional stores. And so you are going to be depleted in some respects. So continuing to take a really good prenatal vitamin or a multivitamin during the postpartum is going to be really, really, really beneficial. It's going to help stave off some of the postpartum mood disorders. It's going to help stave off some of that postpartum hair loss because you've had hormones that have been helping your hair grow and not lose it because you're trying to grow a baby, right? So it's going to help kind of offset some of those other things. So paying attention to your nutrition and supplementation is going to be very, very beneficial to your entire postpartum experience, which is hard when you have other people bringing you meals, because when you have that meal train coming in, you're going to probably get a lot of pizza and pasta, right? So try and keep fresh veggies in the fridge or whatever so that you can supplement your meals with things that are going to nourish your body. Your energy will also be low because you are healing. So taking those first couple of weeks to really capitalize on resting as much as possible so your body can use that energy to focus on healing your body. You're going to feel much better if you take 2 weeks really, really easy at 6 weeks postpartum. If you're up at 4 days postpartum and you're going to the park and you're doing all of the chores around the house, at 6 weeks postpartum, you're going to feel much worse than if you hadn't. So a lot of rest. We are aiming for 8 to 10 hours of cumulative rest. We realize that you are probably not going to be getting an 8 to 10 hour stretch of sleep at night. You have a newborn that is going to be nursing every couple of hours, right? And sometimes nursing is going to be 15 minutes. Sometimes you're going to have a baby that's taking an hour. And so your sleep is going to be interrupted. Taking naps during the day so that you are getting enough rest. I know you've probably heard it, sleep when your baby sleeps, right? And it sounds like an impossible thing because there are a lot of things that we want to get done. And we don't have that village. And you guys are probably feeling that really intensely right now because your family's not close. And it's going to be hard. So I encourage you to find a village and to be asking for help now so that you have that support when your baby gets here. Because it's really, really hard to be looking at your house going, oh my gosh, I should be vacuuming the floor, I should be doing the dishes, but I also should be here holding my baby, and I should be resting. It's really hard to balance all of those desires and all of those social pressures to make sure that your house is perfectly clean. But it really is important in those first few weeks to cherish that time that your baby is sleeping and take advantage of being able to sleep and rest and heal your body. Your primary obligation in the first 2 weeks is to care for your baby. So those first 2 weeks, do whatever you can to make sure that that is all you have to worry about is taking care of you and taking care of your baby. That means finding people to bring you meals, finding people that are willing to help clean your house. Newborn behaviors and schedule. After birth, you'll have initial bonding and infant feeding. And then your baby may sleep and give you a really good nap. Sometimes they're going to give you a 5-hour stretch. We typically encourage that you feed your baby every 2 to 3 hours. So if your baby is awake and you are awake, we want you to be trying to feed your baby. Plan to feed the baby whenever you are both awake for the first 3 days. If they're not awake, go ahead and wake your baby about every 2 to 3 hours so that you can try and feed. But you can also expect to be feeding possibly more frequently than that. Every 2 hours, sometimes more, sometimes less. Like we said, there may be cluster feedings, and that's still normal, especially during periods of cognitive and physical development. So there's a book called Wonder Weeks, and it talks about these periods of development that tend to happen about the same time in every baby. And it's really awesome because you can look at it and go, oh my goodness, why is my baby being so fussy? Why is my baby cluster feeding? What are they going through? And it goes through and it talks about what developmental milestones are happening at that point in time. So I highly recommend it. I have found that it's really nice for me to be able to look at it and go, okay, my baby is being really crazy. There must be something that's going on right now, and see, okay, there is something. Because then I feel reassured that there's something that's happening and my baby's not just being super cranky, and it makes me a better parent because I know that there's a real reason behind it. And then if you plan to breastfeed, it takes about 8 hours a day. So that is the equivalent of a full-time job. So being a parent is your full-time job. So now we're going to turn into a little flip it again and talk about easing into parenthood. So we talked about a few of those ways. And then I think the second to last handout in here, I have this chart. And this is for people to sign up to help you. So you can take it to church, you can pass it around the neighborhood, whatever you decide to do. And you can cross things out, you can put different chores on there or whatever. But I have every day of the week, and then they can sign up. You know, you can say that this is for the next 6 weeks or whatever, and they can sign up for a time to help with other kids. None of you have other kids, so that might be one that you cross out and you put in something different. Coming and helping with your dishes, vacuuming, meals, let me shower. Letting them hold the baby or take care of whatever else in the house so that you can go take a shower. Other. So there are a couple of other spots for you to put in whatever you want or whatever they want, whatever they feel like they can contribute to your postpartum journey and your healing. So you have that at your disposal so that people can help you. So sleeping while baby sleeps. Nutrition. Fuel your body. And during the first 6 weeks postpartum, again, it's going to be kind of like labor when I said that you want to be eating foods that are easily digestible. Your body has just gone through a lot. And it is going to be coping with a lot of things, and so digestion is not going to be the primary focus, and we don't want you to be constipated postpartum. So foods that are easily digestible, lots of fiber, lots of water-based food so that you've got enough hydration for your body to be able to digest food. And then getting help that helps. I don't know about you guys, but I've had people that have offered to come and help, and then they sit on my couch and they think that they're being helpful because they're there, and they're not really helping. Or they want to hold the baby while you make dinner for them too. You don't need that kind of help. You need someone that's coming over to your house, and they're the ones that are cooking you dinner while you sit on the couch holding your own baby, feeding your baby. So get help that helps. And give yourself permission to let people serve you. Okay, this is a really hard thing. America, in the top 3 values, is self-reliance. So we feel like we have to do it all on our own, right? How many of you identify with that statement? I need to do it all on my own. Okay. Permission slip granted, you don't have to do this all on your own, okay? Let people serve you, and it is so hard because we do want to do it by ourselves. But parenthood is not a journey that is meant to be taken alone. And it's not meant to be taken by just a husband and a wife that is raising their child. It is meant to be a community effort. So allow people to serve you. Getting out of the house. It's going to be an adjustment. You're going to be learning how to get out of the house with the baby. But getting out of the house can be just exactly what you need. Newborns and infants are more transportable now than they ever will be again. It is easier to get out of the house with a newborn than it is a toddler. I promise. So, putting the baby in a baby carrier or in a stroller and going for a walk. Just get out of the house. Change of scenery is going to be really great for your mental health. It's not winter time right now, and you're not going to have your baby in the winter, so you still don't necessarily need to go to the mall. Exercising is going to help get your body back in shape, and it also can help with your mood. I do encourage you to take it really easy until your bleeding has stopped. So some of the kind of exercises that you may want to do until that point is going for a gentle walk. Possibly some postpartum yoga. There are some good videos like on YouTube and stuff that you can look up that's postpartum. It's just really rejuvenating. It's going to be more of the, I can't think of the word, but just relaxing yoga, but moving your body, stretching your body. and you want to stretch gently because you've had relaxin, your body is now getting rid of that relaxin. But if you want to maintain that flexibility, then you can do that really gently and continue doing that. Don't push your body too hard because we do want your body to adjust back and be really strong and healthy postpartum. So doing too much can put too much pressure on your joints and cause problems later. Dates with your husband or significant other. It's going to be different now that you have a little person, right? So those dates might just be like 10 minutes at the end of the day where you say, I just want to sit and watch a funny video and eat ice cream with you and hold your hand, because you're not going to be getting out of the house as much unless you want to hire a babysitter or you have a lot of family support that's going to sit with your baby. But connection with your partner is going to be really crucial because you are experiencing changes to your relationship. You are now not only with each other, but you're now parents. And so there's now this triad that's happening, and you're learning how to navigate that change. So connection. Taking a baby break. Mommy guilt is real, but taking a break from your baby is good for you. Giving the baby to dad so that they have that time to bond can be very, very good for them. So taking a break from your baby so that you can do whatever it is you need to do, so that you can go take a shower, so that you can run and get that meal that you've been craving from Chick-fil-A or whatever. Taking 5 or 10 minutes away from your baby is okay. And it's also okay to take a baby break when your baby is really upset. Sometimes they are going to cry and scream, even when their diaper has been changed, they've been fed, you know that they aren't tired because they just slept. Sometimes babies are just going to be unhappy, just like us. Sometimes we have days where we just don't feel good and we're just really grouchy. And your baby is going to be experiencing emotions too. And it's okay to set your baby down and walk outside of the house for a few minutes and let your baby just be really sad, because it can be overwhelming and it's okay to step away. Saying goodbye to the old life. So sometimes people like to do something kind of ceremonial. Your life isn't going to be the same anymore. You've got a baby and it's going to be beautiful and it's such an amazing new life. And there are going to be aspects of life that you're going to miss. You're going to miss some of those things, like being able to go camping whenever you want to, or being able to leave the house at the drop of a hat. You're now going to have to get a baby in a car seat, put them in the car, and make sure that you've got diapers in the diaper bag and wipes and all of the other things that you might need just in case when you leave the house. And so it's going to be an adjustment. And then again, eating well. So not only nutrition, but eating consistently. You want to maintain your blood sugar. You don't want to get tired or grouchy. Keep a good supply of nutritious, easy to prepare foods in your fridge. So that can be carrot sticks, celery sticks, whatever it is that you like to eat that's easy to access. And then reaching out to moms of other young children. We have now created kind of this cohort. You guys have met each other, and all of you are going to have babies that are pretty close together. And you're going to be going through really similar experiences around the same time. And it's really important to have that connection with other moms so that you don't feel so alone. Because when you have your sister-in-law that had a baby that is now 3, she's been through it, right? But she's not in the thick of it with you. And you can still rely on her. But it's nice to have somebody that's in it with you that you can talk to and relate to. And then I'm going to backtrack just a smidge because I just thought of something that I didn't actually put in my breastfeeding handout. But with eating well, eating consistently, I like to recommend that people create what I call a lactation station. They've got a little basket that's got healthy snacks, a bottle of water, things like that. Maybe a book that you like to read if you like to read and you can do it one-handed or whatever. Things that are going to help nourish and keep your sanity as you are breastfeeding. And you can keep it in the place where you like to nurse your baby, or have a basket that you can grab and go wherever you're going to be feeding your baby. So that you can snack and you can drink and you have that reminder, I've got a water bottle, I need to drink. So that you're drinking when baby's drinking so you can stay hydrated. Okay, last page in our little book. Sexuality postpartum. People don't like to talk about it because that's really private, right? Things are going to change. Your postpartum bleeding may continue up to 6 weeks. We're hoping that you're not going to be bleeding that long. If you need to be sutured, your sutures are going to dissolve around 2 weeks. If you are a breastfeeding parent and there are constant demands on your body, you may feel touched out. It can be really hard to have that sensory overload. You don't want to be touched. And you may experience decreased libido due to the emotional and physical demands on your body. And that is normal. Your energy stores have been depleted and you're spending time up with your baby in the night, and you might be too tired. Hormones can cause vaginal dryness, which can lead to discomfort and pain postpartum. Ovulation occurs before you menstruate. Ovulation will occur before you menstruate. And then the flow of oxytocin that initiates a letdown when you're feeding your baby is similar to what is experienced during intimacy. So when you are being intimate with your partner, you may experience milk being let down. And your breasts may be full or sore due to breastfeeding, and your vulva may be tender from delivery. So communication about all of these things with your partner is going to be really critical so that you can maintain that connection and that intimacy with your partner. Communicate your feelings about your body, because you may be a little bit self-conscious. Your body has changed and it's not going to look the same. And your skin is going to be hanging a little bit different. Your belly button isn't in the same place anymore. And now it's a little bit saggy or whatever, and you just may not feel like yourself. And it can be really hard to see yourself in the mirror and to feel like you're that beautiful woman that they married and the person that you want to be or whatever. And so expressing those feelings to your partner so that they're aware of what's happening inside your head. You may be worried about pain or your healing. You may be uncomfortable with the prospect of leaking milk during intimacy. And if there is any pain or discomfort, let your partner know. And then let them know what feels good to you. And participate in non-sexual intimacy like holding hands and cuddling, etc. And then just maintaining intimacy, maintaining that connection, communication, and just being with each other is one of the greatest things that you can do. And so going on dates is going to help maintain that intimacy. And so there are other things that you can explore together, but just maintain that connection. And know that it's normal to be touched out, and it's normal for those things to change. And you guys can figure it out together. You don't have to feel like you're isolated in this experience, because it's just one of those taboo things in parenthood where we just don't talk about it because it's awkward. And what's in the bedroom is supposed to stay in the bedroom, right? If you are experiencing any pain or discomfort when you do resume intimacy, that is something that we should be informed about so that we can help support you in discovering what may be going on. We can make sure that you are healing properly. If there's anything that is going awry, that we can get you the proper counsel so that it can be resolved. You guys are gonna have faith? Okay. It's 11:30 almost. Do you want to break for lunch now, or do you want to jump in?
How are you guys feeling? Hungry? Ready for a break? No? Keep going for a little bit?
No, whatever.
It's up to you. I had one question. You had mentioned like Tylenol and some other
Yes.
pain management stuff.